Good morning, or good afternoon. My name is Michael Halpern. I'm Deputy Director of the Center for Science and Democracy at the Union of Concerned Scientists. Welcome to this virtual public hearing hosted by the Union of Concerned Scientists on the Environmental Protection Agency's proposed supplemental rule titled Strengthening Transparency in Regulatory Science. This session is being recorded and should post to the UCS YouTube page shortly after the session ends. We appreciate you taking the time to provide public comments on the proposed supplemental rule. Nearly 100 people registered to provide public comment today. We're going to begin hearing public comments shortly, and we do have some space at the end of this session. So if you would like to register to speak at the end of the session, please email ucsvph@gmail.com. That's ucsvph@gmail.com. First, I'm going to turn this over to Ken Kimmel, President of the Union of Concerned Scientists. Ken, please go ahead.
Hi, good afternoon to some, good morning to others. Let me just check, can everyone see and hear me?
Yes.
Yes, we can.
Great. Well, I'm going to start by saying that we actually shouldn't be here today. The Union of Concerned Scientists is hosting this public hearing because the Environmental Protection Agency has refused to do so. It is highly unusual for a non-governmental organization like us to hold public hearings on a significant public policy proposal that's being advanced by a federal agency. Typically, of course, when a federal agency puts a rule out for public comment, it's their responsibility to hold a public hearing, particularly while the public comment period is open. Interest in this particular proposal is very, very high. The initial draft of the proposal went out for public comment, and there were roughly 600,000 public comments that were entered into the record in a 3.5-month time frame. Now, this supplemental rule that we're here today to talk about significantly changes the initial proposal, but the opportunity for public input on these changes is currently severely limited, especially when one considers the sweeping nature of this proposal and the many ways that the EPA has made changes to the proposal since the original draft. For purposes of this proposal, the EPA originally provided a 30-day window for public comments with no public hearing. They recently extended the public comment window to 60 days with a deadline of May 18th, but with no public hearings. In our view, this is grossly insufficient. During normal times, the government recommends a minimum 60-day comment period for the simplest of proposals. But these are not normal times, and this is not a simple proposal. Numerous science and public health organizations, including UCS, urge the EPA to extend the public comment period by at least 60 days, preferably 30 days beyond the end of the declared national public health emergency. We also asked for virtual public hearings. The agency has unfortunately refused both of those requests. We went an extra mile and invited EPA to send staff to listen in on today's hearing and ask questions of those providing comment. EPA also declined that invitation, unfortunately. Now, the COVID crisis poses profound challenges to our country and to our world. The virus has disrupted all of our lives. Many of us are working remotely while caring for children who are out of school. Others are taking on this crisis directly and working extra hours at great risk, from healthcare workers to sanitation workers. Public health organizations are working overtime to provide scientific advice to protect individuals and communities throughout the country. Some people even have reduced access to technology. So all of these conditions make it extremely difficult for public comment. And therefore, it is enormously impressive to me that more than 100 people have registered to speak today. This is a testament to just how many people realize the significance of this proposal as to EPA's ability to meet its mission to protect public health and the environment. We heard, by the way, from many more who don't have the bandwidth to provide comprehensive feedback on the proposal due to other commitments created by the pandemic. Today's public hearing, of course, is not the only opportunity that you'll have to provide public comment. I encourage everyone to develop written comments to respond directly to the proposal, and UCS has developed a guide to providing effective public comments on this rule on its website. So let me leave you with a framing question. I know that all of us can and must agree, especially in the light of the crisis we're in now, that the best science, the best data, and the best analysis is not only important, it's not only essential, it is literally a matter of life and death. So the question for today, is the EPA's proposal on the table likely to advance that imperative of having the best science available, or will it undermine this imperative? And I think that's the key question to focus on. So I'm going to turn it back to Michael. We expect the EPA to do its job and seek feedback on its proposals. But when the agency fails, as is the case today, it's our job to step in and make sure that the agency receives as much feedback as possible. So I look forward to the comments today, and I want to thank all the people who have signed up to take part of this important endeavor. And with that, I'd like to turn it back to you, Michael.
Thank you, Ken. So I'd like to provide a little bit of background information and briefly describe the proposed rule on which we are taking comments today. So the EPA describes the rule as follows. The supplemental notice of proposed rulemaking proposes that the scope of the rulemaking apply to influential scientific information as well as significant regulatory decisions. The notice proposes definitions and clarifies that the proposed rulemaking applies to data and models underlying both pivotal science and pivotal regulatory science. In the SNPRM, EPA is also proposing a modified approach to the public availability provisions for data and models that would underlie significant regulatory decisions and an alternate approach. Finally, EPA is taking comment on whether to use its housekeeping authority independently or in conjunction with appropriate environmental statutory provisions as authority for taking this action. Now, for both oral and written comments, EPA will only consider feedback that directly addresses the supplemental proposal. Therefore, please do your best to speak to the changes in the rule that are made in the supplemental proposal. Today's hearing will work as follows. Members of the public pre-registered to speak and were assigned a speaking time. They were asked to sign into the webinar at least 20 minutes before their scheduled time in case we run ahead of schedule. We are here today to hear your comments on EPA's proposed supplemental rule. We will not respond to questions from attendees or speakers. In order to accommodate all speakers, testimony is limited to 4 minutes. After your name is called, we will ask you to proceed with your testimony. A transcript from this public hearing will be submitted to the docket, and a recording will be made publicly available. If you have written comments or other documents you would like to submit for the record, please email them to the email you received your confirmation from, which is ucspvh@gmail.com. That same email, if you are watching the broadcast, you can also register to speak by emailing ucsvph@gmail.com, and you will be added to the queue as time permits. We will make our best effort to ensure that any comments spoken in languages other than English will be translated into English in the written transcript. If you have any additional comments after today, please follow the instructions in the Federal Register notice for this proposal and submit them by May 18th, 2020. And again, UCS has provided a guide for people who want to make effective comments on its website. Today's hearing is broken into 3 separate sessions, the first of which began this morning at 9 a.m., this session at 1 p.m., and one later today at 5 p.m. Eastern Daylight Time. Each session is being streamed live at the Union of Concerned Scientists YouTube channel and can also be viewed on the UCS website. And finally, we ask for your patience during this virtual hearing because we know that people have varying internet bandwidths and familiarity with this kind of technology. And if someone has technical difficulties when it's their turn, we will move on to the next speaker and return to the person who had technical difficulties later in the session. And people can always submit their testimony as prepared for delivery if they decide or if they have trouble overall. All right, so let's get started. I'm going to turn it over to Jason Jacobson, who's going to be running today's hearing. Jason, please take it away.
Thank you, Michael. As a reminder, all attendees are muted automatically. We will unmute you when it is your turn to speak. If you wish to turn on your video, you may do so. We will now begin with our public comments. The first speaker will be William Riley, followed by Nsayadu Witherspoon, and after that, we have Surili Patel. William, you may begin.
Thank you. It's extraordinarily constructive of the Union of Concerned Scientists to take on the responsibility of doing what EPA has chosen not to do in this instance, which is to have this public hearing. Let me just say that looking back to the beginnings of EPA, the administrator then, Ruckelshaus, said that he felt constrained by the insufficiency of scientific and health information, which he needed to set early standards and criteria. Since that time, EPA has given the highest priority to ensuring the integrity of the science on which its regulatory decisions are made. Enormous consequences flow from those decisions. Non-attainment of cities, which have significant economic reverberations. The confidence of the public in the protection of their health. The trust to comply with difficult and sometimes costly regulations. In 1989, the Science Advisory Board, at my request, analyzed the policies of the agency. And the question was, to what degree do they respond to the priorities that you see affecting the health and the ecology of the United States? They set out the criteria with a great deal of supporting data and analysis. And I used, and other administrators have used, the science from them, from the National Academy of Sciences, from the National Institute of Health, through long-standing protocols which affect the quality and preparation of scientific opinion. Those are being called into question by EPA at this time. It is enormously consequential that we reconsider elements of this proposal. Other countries watch very closely what we do. I can recall the Chinese chose to abandon their plan to build 10 million refrigerators containing chlorofluorocarbons, ozone depleters, as a consequence of EPA research. The decision made in 1992 to declare side stream smoke a Class A carcinogen was immediately accepted by the American public as a substantial decision based upon health criteria that deserve to be respected. And within 2 years, 400 cities had changed their rules on side stream smoke and smoking indoors. What EPA does depends on the confidence of the public. It depends on the integrity of the science basis for its decision-making. Both have been put into question by the current proposed regulation.
Thank you, William. Next, we have Nsayadu Witherspoon, followed by Surili Patel, and after that will be Laura Bender.
Thank you so much to UCS for this opportunity. For over 28 years, the Children's Environmental Health Network has been a national voice committed to protecting all children from the harmful effects of environmental hazards and to promoting a healthier environment. As the executive director and on behalf of CEHN, I appreciate the opportunity to provide these comments on EPA's proposed supplemental rule, strengthening transparency in regulatory science. CEHN is strongly opposed to the proposed supplemental rule and believes it is even more harmful to children's health and safety than the previous version in many ways. The original proposal rule sets transparency standards that are too rigid and impossible to meet. it required that all data used in rulemaking be publicly available and allows EPA to exclude data that relies on confidential patient information. Critical studies which have led to significant advancements in protected policies, for example, from the EPA NIEHS's Children's Environmental Health and Disease Prevention Research Centers, may certainly be excluded. This supplemental rule expands which studies can be excluded even further. It now applies to an influential science at the agency, to all influential science, not just the science used in regulatory efforts. The original exclusion applied only to those dose response research evaluating at what level a chemical is toxic. Further critical studies on health impacts, which use medical information, would also be excluded. The supplemental rule requires a lengthy and cumbersome reanalysis of already rigorously reviewed and analyzed raw data to make sure there are no errors in data calculations. This is a lengthy and unnecessary requirement, especially since scientific studies and data analysis undergo rigorous peer review and standard quality assurances and control. And EPA already has a review process in place. All of this additional data analysis and number crunching is a waste of time and result in delays to public health protections, not to mention the cost of the reanalysis to the agency and to researchers. The new standard would also put greater weight on studies that make the raw data publicly available. This criterion is arbitrary and does not judge a study by standard scientific evaluation, such as the strength of its design or methods, which are current acceptable metrics used to evaluate the merit of a scientific study. Lastly, EPA has made no attempt to address the 600,000 comments received on the original proposed rule, and in doing so has essentially ignored the scientific community as well as leading public health organizations regarding valid concerns to the public's health and safety. Given these comments were never addressed, the concerns, including those submitted by CEHN regarding children's health, stand, including two very important comments. The proposed rule would restrict EPA's ability to set regulations informed by confidential data that cannot be replicated. This is of serious concern because for many older, long-standing landmark studies, the original data sets were either not maintained or stored in outdated formats, and these could be eliminated under the proposed rule. The proposed rule could also block the use of long-standing landmark studies on the harmful impacts of the toxic exposures and pollution, studies which were instrumental in the creation of the Clean Air Act, the Safe Drinking Water Act, the Food Quality Protection Act, and others. Now more than ever, CEHN is concerned with this supplemental rule that will adversely affect EPA's ability to use the best available science in decision-making and negatively influence existing and future protections for children's health, such as clean air, clean water, and prevention of toxic exposures. CEHN is also concerned about many aspects of the supplemental rule that are cumbersome, unnecessary, and costly. As we did with the first proposed rule, CEHN requests that you withdraw the proposed supplemental rule strengthening transparency in regulatory science, restricting EPA's ability to consider best available research, will severely damage the integrity of evidence-based rulemaking. EPA will be unable to fulfill its mission to safeguard human health, especially the health of children and that of future generations. Thank you.
Thank you, and Sayadu. Next up, we have Surili Patel, followed by Laura Bender. And after Laura is Liz Hitchcock. Surili, please go ahead.
Thank you for the opportunity to speak on behalf of the American Public Health Association on the serious public health implications of the Strengthening Transparency in Regulatory Science Supplemental Rule. My name is Surili Sutaria Patel. APHA is a diverse community of public health professionals that champions the health of all people in all communities. Together, we speak out for science by bringing all disciplines of public health together so that we can work on cross-cutting issues. And we publish a peer-reviewed research journal, the American Journal of Public Health, which is regarded as one of the leading scientific public health journals around. We also speak out for action to provide a collective voice to advocate at the federal level for laws and regulations that will advance the public's health and sound science. And we speak out for health because we believe in health equity and access to care for everyone in every community. As APHA's director for the Center for Climate Health and Equity, I work to inspire action and advance policy that addresses climate change at the nexus of health equity. And as the deputy director for the Center for Public Health Policy, I advise the organization's environmental health program. So today, I speak on behalf of the association and our members, the reliable public health professionals that protect communities across the country, when I say we uphold the transparency of science and support access to data. The scientific process is built on validation and peer review. The strengthening transparency in regulatory science supplementary rule would greatly limit the research used to inform national action to protect the environment and the public health effectively. And the scientific process has checks and balances to minimize methodological biases against certain populations. So picking and choosing to admit certain studies may limit a comprehensive picture of the problem and possibly the solution, thus perpetuating health inequities. EPA should use the best available research to set limits on air pollution, exposure to toxic substances, and establish public health protections for other environmental threats. There are many instances where exposure of raw data to the general public would mean revealing patient information which should remain confidential as an ethical measure to conduct research. However, excluding this research would substantially weaken the science needed to support environmental public health regulation. By including influential scientific information within the scope of the rule, EPA restricts its ability to use the best science available in decision-making. It also works towards biasing the scientific process and stacking the deck against vulnerable populations, like low-income communities and communities of color. Some communities are exposed to both intrinsic factors like life stage, genetics, and underlying diseases, as well as extrinsic factors like social and life circumstances such as poverty that determine a biological response to chemical exposure. To protect communities faced with co-exposures, EPA must establish science to adequately identify and assess susceptible and highly exposed groups. Therefore, we join other leading public and environmental health organizations to urge EPA to withdraw the rule in a time where science and evidence-based strategies are the only way to protect communities across the country. Thank you.
Thank you. Next up, we have Laura Bender, followed by Liz Hitchcock, and after Liz is Gretchen Goldman. Laura, please go ahead.
Good afternoon. Thank you so much to the Union of Concerned Scientists for holding today's virtual public hearing. My name is Laura Kate Bender, and I'm the National Assistant Vice President for Healthy Air at the American Lung Association. The Lung Association's mission is to save lives by improving lung health and preventing lung disease. We strongly oppose EPA's so-called strengthening transparency in regulatory science supplemental proposal. Today, you've heard from many representatives of the public health and medical community, including some of my colleagues, about the ways this proposal would undermine human health. I'd like to take a few minutes to highlight the lack of transparency in EPA's work on this rule that got us to this point. This is a sweeping proposal that would impact a wide range of public health safeguards, essentially affecting every future decision at EPA. And yet EPA's process in issuing it has been haphazard, rushed, and anything but transparent. When the original version of this proposal came out in 2018, then Administrator Scott Pruitt prematurely announced it while it was still undergoing agency review, interagency review at the White House Office of Management and Budget. Then when the media inquired about the discrepancy, OMB actually backdated the clearance by several days. If that date is accurate, it means that OMB only originally reviewed the proposal for 48 hours. This rule was also originally proposed without a regulatory impact analysis. EPA then originally failed to consult the agency's own science advisory board about the proposal. The SAB has since released a draft report finding significant deficiencies with the proposal and held public hearings. We strongly urge EPA to wait until SAB has finished considering the rule and then take the recommendations from the board into account before moving to finalize it. The supplemental rule is a significant revision and expansion of the original proposal, and it merits an official EPA hearing of its own. We appreciated the opportunity to participate in EPA's public hearing on the original proposal. We also appreciated that EPA extended the public comment period on this version of the proposal from 30 to 60 days. However, that extension and the lack of official public hearing do not allow for adequate review of the rule, especially by the public health and medical community. Pulmonary and critical care physicians, nurses, respiratory therapists, and others who are on the front line of COVID-19 response. Many researchers who study lung disease and are very interested in the proposed rule are focused on testing and treating patients to prevent further spread. Extending the comment period further could push back the deadline to a time when these experts will have more opportunity to prepare meaningful comments. My experience at the American Lung Association has been that the public health, scientific, and medical experts we work with are more interested in offering input on this proposal than most other EPA actions I've ever worked on. Before the pandemic, when the supplemental proposal was under review at OMB, we organized a meeting with them by phone that brought together 9 researchers and medical professionals from across the country. These lung health experts shared with OMB the many ways that the existing scientific process is sufficient for ensuring transparency while protecting study participants' privacy. They also shared the potential implications for patients if future air pollution standards are not based on the available health science. Now, however, the health and medical professionals that volunteer their time for the Lung Association are stretched thin. This proposed rule has major implications for their work, but many are responding to the COVID-19 pandemic and simply need more time to weigh in meaningfully. The Lung Association fundamentally disagrees with EPA's premise in both the original and supplemental proposal. The science that the agency uses to inform its decision-making is already transparent. This rule is a solution in search of a problem. However, even if EPA moves forward, we urge the agency to take the final SAB recommendations into account first, as well as to allow additional time for public comment, taking into account the COVID-19 pandemic. Thank you.
Thank you, Laura. Next, we have Liz Hitchcock, who will be followed by Gretchen Goldman. And after Gretchen, we have Liz Borokowski. Liz, you may go ahead.
Thank you. My name is Liz Hitchcock, and I direct Safer Chemicals, Healthy Families, a national campaign to protect Americans from toxic chemicals. We lead a coalition of local, state, and national organizations that came together out of our concern, our common concern about toxic chemicals in our homes, places of work, and products that we use every day. This public hearing is magnifying the voices of the American public, a public that has had its health harmed again and again by our exposures to toxic chemicals. We applaud UCS for stepping up and doing the job that the Environmental Protection Agency should have done. And we're ecstatic that there are so many participants that I've got a strict 4 minutes limit, so I can't really spend enough time thanking UCS. EPA's proposed supplemental rule is flawed and ill-conceived. In the name of transparency, it will burden EPA scientists with unnecessary and costly processes that run counter to the agency's longstanding obligation to base public health decisions on the best available science. The damage that the rule will inflict on the quality and timeliness of EPA science is not justified by any benefit of the proposed rule. While its supporters have painted a bleak picture of EPA reliance on so-called secret science developed behind so-called closed doors based on data that's been withheld from the American people, is that really the problem? Or is this an effort to solve an imaginary problem, something that they call so-called secret science? Something that saying that in order to strengthen transparency, the EPA should only use research if the public can see every last piece of underlying raw data. If enacted, the censorship of the so-called secret science rule would allow EPA to ignore thousands of rigorous peer-reviewed health studies, making it harder for EPA staff to protect us from toxic chemicals and easier for the Trump administration to roll back regulations. EPA scientists working on health and risk and health hazard assessments collect and review thousands of studies. Published reports of these studies typically don't include all of the underlying data. Under this proposal, EPA would need to contact the researcher, ascertain the nature and extent of underlying data, and put in place a mechanism for the public to access the data. Analyzing the House legislation that would impose similar obligations on EPA, the Congressional Budget Office and EPA staff concluded that the cost of implementation would be at least $250 million a year. Moreover, rather than devoting the time and effort to assure access to underlying data. EPA staff may follow the path of least resistance and simply drop many studies from consideration, shrinking the body of scientific evidence on which decisions are based. EPA science assessments generally include an exhaustive and critical review of relevant studies and a full explanation of how they're being interpreted. Extensive information about each study is typically part of the public record, even if all underlying data may not be included. EPA assessments are normally subject to public comment and independent peer review, and members of the regulatory community are free at any time to replicate studies they deem flawed or to independently seek access to underlying data and reanalyze them. In short, the so-called problem that the proposed rule seeks to fix is largely imaginary. Let's make no mistake, the stakes for EPA science and the protection of public health are simply too high to finalize this deeply problematic and unnecessary proposal. And as our lives are disrupted by the COVID-19 pandemic and resources are appropriately diverted to deal with the crisis, we should not be distracted from the fact that the Trump EPA is not skipping a beat on rolling back public health protections. Thank you for holding this public hearing, and thank you for all of the work that UCS does.
Thank you, Liz Hitchcock. Next, we have Gretchen Goldman, who will be followed by Liz Borkowski. And after Liz Borkowski, we will have Liz Miller. Gretchen Goldman, go ahead. Gretchen, go ahead.
Great, thanks. Thank you for the opportunity to comment. I'm the research director at the Center for Science and Democracy at the Union of Concerned Scientists. Much has been said about the ways that the EPA's April 2018 draft rule would undermine the ability of the agency to carry out its mission. Today, I'd like to focus on elements of the supplemental notice that worsen the impact of this rule. First, the supplemental proposal expands what was already a sweeping proposal. With expanded definitions and more inclusive terms, such as applying the rule to all models and all influential science, it is now crystal clear that the policy stands to fundamentally alter how the EPA can use science to protect public health and the environment. Second, the tiered access approach proposed in the supplemental notice fails to address the central underlying concern with this rule, that it would require the disclosure of confidential data in order for the EPA to use the science. Even if a tiered access approach is implemented, researchers cannot share personal health data that they are legally and ethically bound to protect. The supplemental notice fails to address this fundamental threat to the agency's ability to use the best available science. Further, a tiered access system would be costly and near impossible for the EPA to implement with existing resources, let alone individual researchers if the responsibility were passed to them. The proposal provides no clarity on who will be responsible for the launch and maintenance of a tiered access system and how it would be managed, an endeavor that would require significant resources in order to mirror the CDC's Research Data Center, which the supplemental notice cites as a model. The alternative weighting approach proposed would unfairly and arbitrarily devalue legitimate scientific work that the EPA relies on. At an agency charged with protecting public health, studies involving health data are especially crucial. Many of these crucial health studies will be needlessly downgraded in EPA decision-making under this weighted approach. Alarmingly, the supplemental notice states that the goal is for stakeholders to reanalyze the data and models that EPA uses. This is a waste of time and resources for an agency that already relies on extensive stakeholder and public input on rules in transparent ways. Hamstringing the agency's ability to use science for the purpose of providing industry-tied researchers the chance to unnecessarily reanalyze scientific work tips the scales against the public interest. In the summer of 2018, I gave public comment on the draft rule with my 1-month-old infant in tow. I didn't have to be there, but I chose to be. This is a rule that will affect the ability of my children and all others in this country to breathe clean air, drink clean water, and enjoy a safe environment. The EPA cannot do that under this proposal. I urge the agency to abandon this ill-advised and dangerous proposal. Thank you.
Thank you, Gretchen. Next, we have Liz Borkowski, followed by Liz Mueller, and then Leonard Buckle. Liz Borkowski, please go ahead.
Thank you. Thank you for the opportunity to present comments. My name is Liz Borkowski, and I'm the Managing Director of the Jacobs Institute of Women's Health at the Milken Institute School of Public Health at the George Washington University. The Jacobs Institute is disturbed by EPA's supplemental notice of proposed rulemaking to strengthening transparency in regulatory science because its proposed changes are inadequate to address concerns about consideration of studies that involve confidential data. EPA's proposed changes fall far short of a system that would be practicable while engendering confidence among both researchers and potential study participants. To address the fact that participants in environmental health studies are typically assured confidentiality and that this precludes making data publicly available, EPA suggests that when developing regulations or finalizing influential scientific information, it give greater consideration to studies for which data have been made available. Using non-scientific criteria to evaluate scientific studies is thoroughly inappropriate and at odds with established practices for evaluating study quality. For instance, the Strengthening the Reporting of Observational Studies in Epidemiology, or STROBE checklist does not include public availability of data. The threat of ignoring or downweighting a study if its data are not available places pressure on scientists to release data they might otherwise keep confidential. Given the rapidly developing evidence base about the possibilities of re-identifying anonymized data, scientists conducting research today might understandably prefer to err on the side of limiting data access. The supplemental language regarding tiered access, by which authorized researchers can access restricted data and the public a less identifiable form, is far too vague and limited to engender confidence among researchers or those who might consider participating in studies. For instance, it does not define authorized researchers or mention the institutional review boards that govern human subjects research in academia. EPA's invocation of the National Center for Health Statistics Research Data Center, or RDC, acknowledges the necessity of establishing a way to provide carefully controlled access to identifiable data, but it fails to demonstrate that it has fully considered how such a model might be used for the many studies the agency ought to be considering. The supplemental language merely states that the RDC is a model and that EPA is conducting a pilot study on how RDC might host EPA datasets. This falls far short of the kind of detail necessary before finalizing a rule. Because RDC contains data collected by CDC and other federal agencies, not by independent academic researchers, a great deal of additional work and infrastructure would be necessary before it could host the full range of data that should be informing EPA work. The fact that RDC charges researchers $3,000 to access a single year's data hints at the substantial costs associated with the enterprise. EPA does not appear to have calculated the costs that the agency and outside researchers would incur in order to create a system that evaluates researchers' proposals and provides them with access to the appropriate level of data. It also has not explained who would be in charge of making those determinations, a crucial issue given that communities disproportionately harmed by pollution might not trust EPA to make them. EPA's proposal forces an untenable choice on researchers. Know that their study will be inappropriately downweighted, or accept the problems that can accompany submission of their research into a repository that has not been satisfactorily described. When environmental health researchers inform potential study participants that their data will be placed into such a repository, they will likely find it harder to recruit. The problem will be particularly acute in historically marginalized and disproportionately polluted communities whose involvement is essential. If EPA moves forward with the rule it has proposed, it will undermine science in decision-making by making it difficult and potentially impossible to conduct and consider the best available science. This will have detrimental impacts on reproductive justice, health equity, and women's health. The Jacobs Institute of Women's Health urges EPA to withdraw this rule. Thank you to the Union of Concerned Scientists for holding this hearing.
Thank you, Liz Borkowski. Next up, we have Liz Mueller, followed by Leonard Buckle. Liz, go ahead.
Thank you so much. Good afternoon. My name is Liz Muller, and I am the National Director of Advocacy of the American Lung Association's Healthy Air Campaign. Today, you've heard from individuals in the public health and medical community, including some of my colleagues, about the dangers of the Strengthening Transparency and Regulatory Science proposal. Today, I'd like to talk about the processes already in place that review health studies, highlighting how the science EPA uses is already transparent. The proposal excludes studies whose underlying data cannot be shared with the public. It introduces alternative pathways that may be deployed to allow consideration of some studies, but make no mistake, key studies will not be fully considered if EPA finalizes this rule. While studies involving laboratory animals might be able to meet this requirement, many studies examining the effects of environmental stressors on real people will not be able to meet the demand of public data sharing. Publicly sharing information about diagnoses, hospitalizations, or deaths, as well as where a study participant lives, works, or goes to school, is not feasible because it would constitute a major breach of privacy. Before a health study of humans can even begin, investigators must complete a rigorous review by an institutional review board to ensure that the risks to participants, including risks to privacy, are minimized. As part of its review, the institutional review board carefully scrutinizes the consent form that study participants will sign to ensure the form details how participants' private data might be shared and what safeguards will remain in place to protect their privacy after the study's completion. This proposed rule by EPA would prevent most research about the health effects of pollution in the real world from informing EPA policy because the underlying data about the participants of these health studies cannot be shared with the public. On the question of replication, there already exists a mechanism within the scientific community to validate studies. Major health journals, including Lancet, the Journal of the American Medical Association, and the New England Journal of Medicine, and agencies like the EPA require researchers to specify a data sharing plan as part of their research application. The purpose of this sharing from scientist to scientist is to facilitate the replication of findings or to pull together data from multiple studies. There are strict requirements outlined in a signed agreement among those involved that the receiving scientist must demonstrate that she or he has the skills, resources, and safeguards to appropriately use and protect the data. If there are questions, entities like the Health Effects Institute, or HEI, have conducted review. For example, in July 2000, the Health Effects Institute conducted a reanalysis of 2 early air pollution studies, the Harvard 6 Cities study and the American Cancer Society study on the link between particulate matter pollution and mortality. The reanalysis was conducted by a team of independent scientists, was overseen by a diverse board of stakeholders, and affirmed the findings of the original studies. Publishing a scientific health study is a years-long process that involves intense scrutiny from others in the scientific community. To say that published studies that have gone through this process are not reviewed and validated is absurd. The science that the agency has used for years is already transparent and rigorously reviewed. The EPA is trying to fix a problem that does not exist. Thank you so much for your time and for your attention today.
Thank you, Liz. Next, we have Leonard Buckle. Leonard, go ahead.
Thank you very much for giving me the opportunity to make my comments about the EPA changes to its standards. My background is 40 years of doing research in methodological approaches to the study of interdisciplinary problems. My professional perspective is that of a philosopher of the pragmatic persuasion. The approach to science that the EPA chooses to use to make distinctions between those pieces of science that would be regarded as acceptable and those that are not is something left over from pre-Wittgenstein European philosophy. It is a purely objectivist point of view and is totally out of line with American thinking for the last century and a half. The dichotomy draws invidious comparisons between most acceptable pieces of social research medical research and biological research, and those pieces of research that would be appropriate for laboratory science of the physical, chemical, or possibly biological persuasion. This dichotomy further is the wrong set of dichotomies, is the wrong dichotomy to draw for the Environmental Protection Agency. Their choice of replicability, public data, and reproducibility is actually accomplishable only by a small fraction of all science, and the fraction tends to lie outside the area of the EPA's involvement. We are privileging bench laboratory work in sacrifice of more substantial and relevant material concerning environmental protection, public health, and general public safety. The third major problem is that this research is entirely at odds with the ethics and technical limitations set forth by other agencies, as my previous colleagues have discussed. This research is impossible. Research that would fit the standards is impossible under the guidelines of any IRB and any institution doing business with the United States government. This leaves the research available virtually non-existent. In effect, the EPA is defining away its very base. This opens the way to me for a concern for what alternatives the EPA chooses to imagine for its basis for making decisions. In particular, I am concerned in the extreme that instead of using scientifically based facts, they're going to be building models built on speculation and public and private opinion. My concern is raised because for several years, I have been involved in research into the operations research. And my concern is that one can build into the models one produces the assumptions one wishes to set to accomplish the outcome one wishes to have. In other words, your only proof of a model success is that it ran, and that does not prove that it has any correlation at all with reality. I fear the EPA is going to employ this as its major vehicle for decision making as an alternative to science. Thank you.
Thank you, Leonard. Next up, we have R. Stephen Barry.
Yes. I have very little to contribute, except one thing that I've become very embittered about the whole way that this administration has dealt with the EPA, with the environment, with all the issues that we are discussing today. And it seems to me that this administration has simply changed the name of the EPA. It's no longer the Environmental Protection Agency. It's become the Environmental Pollution Agency. And that's my contribution, I'm afraid, my bitterness.
Thank you, R. Stephen Barry. Right now, we have a few attendees who haven't been able to join us electronically, so we will be taking a short break. We want to make sure that we stay consistent with the schedule and people's scheduled speaking times. So we will take a short break until 2:10 p.m., at which point we'll hear from Mark Peters. Thank you very much. Hello, everyone. Welcome back. We will now hear from Mark Peters. Mark, are you ready?
I am. Thank you very much. I appreciate your labor on all our behalf, by the way. I have a degree. Are we ready to go?
Go ahead.
Thank you. I have a degree in philosophy and a degree in medicine, and have been a physician assistant for over 40 years, primarily doing cardiothoracic and vascular surgery, and have been a researcher and managed data sets and data collection for national studies. At any rate, when asked to explain the difference between a doctor and a PA, I've answered by explaining that if you want to know why something works, ask a doctor. If you want to know how something works, ask a PA. Along those lines, I'd like to talk about the work of scientists and statisticians. And rather than talking about confounding variables, randomization, matching, observer or subjective bias, and on, not to mention at all the willingness of study participants to share personal data like cholesterol level or body mass index, I'd like to tell a little story. That story is of a small town where the town selectmen have been asked to try and consider some actions to increase the number of ministers in the town. At the next town meeting, the selectmen bring the matter up, and someone notes that towns with more telephone poles have more ministers. That said, a motion is passed to add more telephone poles to the town. Of course, it's at great cost, with, from our outside view, having the predictable result of no increase in the number of ministers. Of course, this might be a hopefully humorous, but yet insightful story to consider the fact that science should be left to the scientists, data should be left to the statisticians, and as has been pointed out by many other attendees, that the processes in place, and in my own personal experience, scientists love nothing more than to prove each other wrong and do a great deal of review and study of data and the analytic processes to analyze that data to say, here's where it should be done differently. And then that is done, and the results of studies are confirmed or not. That's just a superficial understanding of how the science works. The other issue in my career, having done cardiothoracic and vascular surgery, I spent a great percentage of my time treating people with the diseases of tobacco use. And we know the end result of a long history of malfeasance by the tobacco industry to suppress, deny, obfuscate, and actually lie about the data that was privy only to them in the early years of the 20th century. Historically, back to the 1600s, in fact, an anonymous paper was published in London about chimney sweeps who were smokers, suggesting some correlation between lung disease and occupational and personal choice hazards. At any rate, the legal status and the end result of that malfeasance is just an example of how industry might influence data, even at the government level through lobbyists, as we know from that case. And so there is great risk involved. Currently, as of 2018, the data suggests that 480,000 people a year have been dying from tobacco abuse, and that is even with all of the data available to show that it is potentially lethal. So in order to avoid those kinds of situations, we need to ask that this change in regulation not be implemented. Thanks.
Thank you, Mark. Next, we'll take another short break, and we'll come back at 2:25 to hear from Barry Goffman. Thank you for joining us at the virtual public hearing for the supplemental rule on EPA proposal Strengthening Transparency in Regulatory Science. Next up, we'll be hearing from Barry Goffman, followed by Janet Ward. Barry, you may begin your public comments. Barry.
Hi, my name is Barry Gottman, and I want to start off by saying I have no scientific background, but I do have a human functionality background, which has given me the belief to offer this critical opinion of the EPA. So I believe the EPA should change its name to the ENPA, Environmental Non-Protection Agency. 20 plus years ago, I moved myself and my family to Smyrna, Georgia. It had all the attributes I was looking for, but it also had a dirty little secret. ETO emissions in my house was only 3 miles from the source of the emissions, Sterigenics. Up until 2016, ETO was classified as a potential human carcinogen. In 2016, it was reclassified as a known human carcinogen. No warnings, either written or posted, existed to warn citizens then as now. Citizens and politicians were completely in the dark. The new 2016 ETO classification was actually covered up by the EPA, Karen Hughes, who's the director of toxicity here in Georgia, who never even sent out a press release saying the public wouldn't understand. Sterigenics has been operating, emitting very high over the legal limit levels of ETO for 40 years and was allowed to hide in plain sight and operate on a storage facility operating permit, not the hazardous duty permit, facility permit it should have been. Who was the EPA protecting here, residents or big business? My lifestyle has always been one of health and fitness, including many Ironman triathlons and marathons. 3 years ago, I was diagnosed with an incurable form of leukemia, which all but took my fitness lifestyle away. I spent more than 14,000 hours working out on the Silver Comet Trail, which is a fitness trail located less than 2 miles from Sterigenics over the last 20 years. I believe this long-term exposure to the unknown carcinogenic ETO gas and an increased lung level usage caused and or directly contributed to my cancer. Others with the same lifestyle as I in other parts of the country report similar occurrences. The cancer has caused me side effects, including severe anemia, which sometimes leaves me breathless from just getting out of my car. It has also caused other types of cancers and neurological problems in many others who live in close proximity of Sterigenics ETO plant exposure. The EPA and the Georgia EPD have shielded this company from reprimand, including helping them craft a behind closed doors work order to upgrade, change their plant's emission system without public knowledge or view. This breaks the law that they wrote. When the legality of this agreement was challenged, Sterigenics was banned from the building until a correct operating permit was in place. Then the EPA looked the other way when they blatantly ignored that order and did the work anyway while they were still under the confines of this order. Sterigenics has operated without consistent and reportable EPA supervision for 40 years and has multiple problems, including explosions and unreported leaks. Are they above the law? The EPA and the FDA show an over-reliance on ETO and are listening to lobbyists to get information rather than doing true scientific inquiry about the problem. This creates a dramatic lack of true data points around ETO pollution. I believe this shows chemical industry capture of our regulatory agencies. Using data modeling based on industry self-reported information subverts the ability of citizens living near these ETO-based facilities to know the full truth about the levels of poisoning that have occurred. Lobbying efforts have created an environment at all levels of government that tips the scales steeply toward the industry and away from the health of our communities. They are protecting no one, just enabling criminal companies that are way more interested in profits over people to continue on that path. Environmental Non-Protection Agency is the correct name for the EPA. Thank you.
Thank you, Barry Gottman. Next, we'll hear from Janet Ward.
Thank you. My name is Janet Ward. I am a resident of New Hampshire and a member of the board of a New England-wide environmental organization. The Environmental Protection Agency was founded in December 1970 under the Republican administration of President Richard Nixon, who was keenly aware of the environmental damage being done in the United States. This damage represented a clear and present danger to public health. The EPA's mission was and ought to continue to be the protection of public health and holding to account polluters whose actions endanger public health. The proposed new rules on what studies the agency can cite in making regulations would be determined by a political appointee rather than by qualified scientists. These proposed rules gut the ability of the agency to oversee and establish necessary regulations to protect public health and safety. The perpetrators of these new rules are banking on the inability of the public to understand and appreciate the danger these changes represent. I am a member of the voting public. I understand the ramifications of these new rules, and I intend to publicize their dangers as widely as possible. These rules are unnecessary, dangerous, and crafted with political objectives in mind. Their implementation would destroy the ability of the EPA to do the work it was founded to do. Thank you for the opportunity for sharing these reflections.
Thank you, Janet Ward. Next up, we'll hear from Andy Bessler. Andy,
Yes.
go
ahead. Can you hear me okay?
We can hear you, and it looks like your video is obscured.
Yeah, I'm not too sure. Oh, sorry about that. My name is Andy Besser. I'm the project director for the National Tribal Air Association, and NTAA was founded in 2002 under the Bush administration for improving air quality with a grant from the United States Environmental Protection Agency, with the mission to advance air quality management programs and policies consistent with the needs, interests, and unique legal status of American Indian tribes and Alaska Natives. Tribes are important partners with federal, state, and local agencies to protect ambient air quality, indoor air quality, and mitigate climate change. The National Tribal Air Association maintains a membership of 151 member tribes around the country, and we are submitting comments on this proposal. And we recently held an informational webinar for tribes around the country on this proposal last week, and that's all posted on our website, which is tribalair.org. The National Tribal Air Association has several comments regarding this proposal from EPA, the supplemental proposal on transparency in science. For one, the comment period is inadequate. Tribes are very much focused on protecting public health and maintaining a strong economy during this pandemic. NTA is opposed to the proposed expanded scope of this proposal. We oppose the EPA's administrator's exemption discretion. We oppose the lack of authority for the proposal and its failure to consider tribes and environmental justice communities. The agency decision-making must be based on the best available science. Some environmental statutes explicitly say this, others it's implied, and others appear to be based on court decisions. This proposal will cause valid and relevant science to be excluded or given less weight, which is out of bounds with EPA's mission to protect public health. The proposal to address public health information is vague and doesn't concern feasibility or cost. The expanding the applicability makes these problems worse, and it doesn't fix any of the existing issues. A big opposition that NTA has is regards to the EPA's administrator's discretion. The proposed exemption that the administrator can grant could put the trust in the administrator without mandatory standards. It could be used positively to exempt public health studies, or it could be used negatively, exempting industry chemical regulation studies, for example. Suggested mandatory exemptions are there for certain studies, or they suggest mandatory exemptions for certain studies, but all this depends on the political direction of one EPA administrator rather than really following what the science dictates. We have opposition to the proposed expanded scope. The proposal expands applicability for significant regulatory actions and discusses other terms like influential scientific information and dose response models. So these are terms that are not really, they're expanding applicability beyond what currently exists. There's a proposal for tiered access based on other federal agency programs. And the proposal applies regardless of when the study was performed. So there's expanded scope that we oppose. Also, there's a lack of authority. The proposal has changed the authority EPA seeks to rely on, and it's solely on housekeeping authority statutes for executive departments in combination with corrective environmental statutes listed in the original proposal. This really is a backward rulemaking, proposing an action and then asking for help to determine authority. It's cited authority that doesn't authorize the rule. And it's in an event of a conflict, the proposal says that other statute or regulations may apply. Finally, there's a failure to consider responsibility to tribes and to environmental justice communities. There was no analysis performed of tribal implications or environmental justice implications. EPA actions, whether they're significant regulatory actions or influential scientific information, will impact tribal communities. And EPA must hear and address tribal concerns with this proposal. Finally, EPA already has a strong system for using science in the rulemaking process. There's integrated science assessments, risk and exposure assessments, all involved in the policymaking process. And if it's not broke, then don't fix it. So we oppose this proposal, and thank you for your time.
Excellent. Thank you for your comments. At this point in the program, we will be taking a short break so that we can stay consistent with our schedule. Please come back and we'll be checking in every 10 minutes. Thank you. Welcome to the virtual public hearing regarding supplemental rule on EPA proposal strengthening transparency and regulatory science, hosted by the Union of Concerned Scientists. Next up, we'll hear from Claire Richards. Claire.
Can you hear me okay?
Claire, we can hear you. You can begin.
Hi, thank you for having me. As a nurse scientist, my oath is to do no harm and to protect the health and safety of my patients. I'm angry that the EPA is trying to further restrict the type of research that can be used in public health protection decisions and scientific assessments. While as a nurse, I really need to be addressing the public safety concerns that are due to the Trump administration's bungled response to COVID-19. In particular, I've been trying to focus on how we can continue to provide high quality care in the context of a pandemic with a shortage of personal protective equipment, especially for the most vulnerable in long-term settings. So I'm pretty angry right now that I am unable to focus on this and that our government is working to push through rules to benefit industries while I need to be working to protect patients and families right now. I oppose the EPA's rule that states that all research used to support agency rules would be covered by these transparency requirements, not just dose response studies. This means that most research focused on the impact of contaminants on human health could not be used because they rely on information protected by HIPAA. This is atrocious and makes absolutely no sense. The HIPAA privacy rule governs public health information, which is individually identifiable information about an individual's care, health condition, or payment for care. I think transparency can be encouraged by making code available, and can improve the quality of science, but not necessarily by requiring scientists to make underlying data available when there is more than minimal risk of being able to identify an individual. I would like to refer the EPA to a paper published called Big Data and Public Health, Navigating Privacy Laws to Maximize Potential, that was published by Thorpe and Gray in 2015. There are ways to modify the rules so that only identifiers including city, state, and zip code are included in publicly available data sets. Furthermore, typical review of studies included in high impact journals rely on peer review rather than publicly available data sets, where the methods and summaries of data set results and inferences and limitations of studies are evaluated. I think it should be noted that the lack of clarity as to how researchers can make their data available or how much it would cost creates a tremendous burden on researchers and should be addressed by the EPA. Furthermore, the fact that the EPA administrator has the authority to waive the requirements for the data to be public on a case-by-case basis is a clear conflict of interest because the administrator is a political appointee, and there is precedent for our government to favor industry and short-term economic rewards over human health. So thank you for having me. I clearly oppose this rule.
Thank you, Claire. We will resume a short break and have check-ins every 5 minutes. Thank you. Good afternoon. You've been listening to public comments provided at the UCS-hosted virtual public hearing regarding the supplemental rule on EPA proposal strengthening transparency in regulatory science. Thank you for joining us this afternoon. This does conclude the afternoon session. The recording of the session should be available on the YouTube page of the Union of Concerned Scientists shortly. The evening session will begin at 5 p.m. and run for approximately 1.5 hours. Thank you. Bye-bye.